Tell me about yourself.
Okay, I've had over 15 years in customer service, experience in delivering customer service to um, meet a patient's satisfaction. I have worked in both the financial and the healthcare field, and I have worked in areas, especially in healthcare, where I've had to do customer service at a very personal level, ensuring that the patient's well being is done to their utmost care, making sure that even though they're ill, that they are satisfied, they are happy with being in the hospital, even though they're going through some kind of illness. So have that has taken my customer service level to a service skills to another level, that I'm even more cognizant of a customer's need.
Tell me about your past work experience.
And as I've said before, I've worked in both the financial industry and in the healthcare field. I started out in banking, where I worked for a number of years, providing customer service to private banking. In private banking, ensuring that customers' bills are met, their accounts are up to date, and I worked there for over 8 years. Then I moved into the financial trading, mutual funds, investment field, and there I also worked in a customer service area where I processed trading for individual customers, which is very important that we have deadlines to meet to ensure that customers' um, trades are processed in a timely manner. Then I moved into the healthcare field where I work as a certified nursing assistant for a year, because after I got laid off from the investment firm, I thought about moving into nursing as a career. So I work as a certified nursing assistant for over a year in a rehab center. And like I said, there I became even more cognizant of meeting the patient needs at another level, because this is to ensure their well-being, um, physically, mentally, emotionally. I had to meet that need for the patient. So I realized then that nursing really wasn't a career I wanted to pursue. So then I went on to find a position that combined my healthcare experience and my administrative business experience. So I got a job at the Massachusetts General Hospital, where I work as a financial access coordinator, where I do approvals for patients who are upcoming surgery or admitted emergently to the hospital. So that's where I am right now.
Tell me about a time you had too many things to do and how did you prioritize your tasks?
Well, over a year ago, we went through a high turnover in my current position, where we lost, out of a staff of 50, we lost about six over a 2 month period. So at that point, my manager asked me to take on a couple additional tasks, because I was a team lead at that point and I was responsible for reviewing 4 work queues for representatives. So she asked me to take on an additional 6 representatives. So I was now responsible for reviewing the work and the work queue of 10 representatives, ensuring the work is processed in a timely manner. And in order to do that, I had to make the commitment to come in early. So what I started doing, I started coming in at 7:30 in the morning to ensure that the work queues are ready for the representative when they start at 8:30. And then I would go on to do my work, because at the same time I still had a workload to complete of my own. And then after that, I'll make myself available to anyone who had questions, and if I had calls to make, I'll save that for the middle of the day, because at the end of the day, then I also had to review the work queues to ensure that all the work was processed in a timely manner. So all my prioritizing was done based on getting everything out in a timely manner, because in this position it's very deadline oriented, because we have 24 hours to notify parents that a patient is in the hospital.
Describe a time you worked well on a team.
Um, Also in this job, when I first started, I worked on a team with 3 people. One of my team member was also the team lead for that team on another team, And at one point, the other team member had to be hospitalized unexpectedly. So we dropped to a team of two. And then unfortunately, my team lead, other team, also lost a team member. So she had to stretch herself between both teams. So we came together to divvy up the work to see the best way it had to be done. So we played off each other's strength. She was more experienced in getting what we refer to as outpatient um, procedures done in a time quickly, whereas I was more experienced in working on the inpatient procedures. So what we did, we divided up the work. She did all the outpatient procedures, I did all the inpatient procedures, and that worked out well because we were able to get through that 2 week period, and there were no errors attributed during that time to any of the work that we did.
Tell me about a time you had to go above and beyond to get the work done.
Um, Again, we go back to that period when we were short staff, and in this position, we have, whenever a patient is admitted emergently to the hospital, we have 24 hours to notify the insurance company. So on a normal business day, that's fine. We have on Tuesdays, Thursday, Wednesday, Friday, that's fine. But on a Monday, we have to notify the insurance company of everyone who is admitted from 5 o'clock Friday evening until midnight Sunday night. That all have to be done on Monday. So usually Monday is a very hectic day. But on a Tuesday after a holiday, we now have an additional day to report. So we'd have to report everyone that came in 5 o'clock Friday evening up to midnight Monday night, and it all had to be done on a Tuesday. So during that period, we were very short staffed. We asked everyone to make the commitment to come in early and work late on that Tuesday in order to ensure that we meet the payers regulation. Because if we did not meet the regulation, we run the possibility of the admission being denied and the hospital not compensated. So we had to put that extra effort in to make sure we get everything done to the payers' qualifications. Mm-hmm.
Tell me about a time when you worked well under pressure.
Working well under pressure, again, I go back to saying this is the part that stands out most when we were short staff. And getting the work done in a timely manner with a good 30% less staff than we would have. That was very high pressure, and we had to go that extra effort, come in earlier, stay late, sometimes work through lunch. And what we also did was bring in extra help from other department. My manager and I, we looked over the workload and said, okay, maybe someone from this department will be able to do this work. And so we were able to divvy up the work with help from other department in order to lessen the pressure on everyone. But it was a very pressured time because we were short staffed, but we still had to meet all the payers' deadlines and ensure that the revenues of the hospital continue.
Give an example of a time you showed initiative.
Um, there was a time when I had two new employees and they were having a little difficulty understanding and getting the work done in a timely manner. And so I decided at that point that I needed to write some additional procedures to assist them in processing the work, because previously our new employee training consisted mainly of new employees coming in and being taught the system. The day-to-day work, we would train them by having them sit with existing staff and learn to work that way. So at that point, again, we were short staffed, so it wasn't the most effective way to teach someone because everyone was so busy and pressured. So what I did was I sat down and wrote a couple of procedures that streamlined the workflow for them. And that worked out very well because those procedures are now being incorporated into our training for all new employees.
Is there anything else you would like me to know?
Um, you know that I'm very experienced in payer regulations, Medicare billing, and I would like the opportunity I'd like the opportunity to work in this department because I see where my experience will be able to increase productivity and also assist in streamlining the workflow process in the department, and also be able to bring my expertise into assisting in increasing revenue into the department, and I would look forward to working in this department.